Welcome to the Deep Dive. I'm Harvey, and with me today is Donna.
Hi, everyone.
So Donna, we're both MCCQE reviewers.
Yes, we are.
And, we're here to help all of you out there listening
Absolutely.
feel more confident as you prepare for this exam.
Yeah.
So
It's the big one.
it can be a little bit overwhelming, right?
Hey.
Sure.
We know. We've been there.
You've been there and done
So
it.
we are going to be breaking down some of the major concepts that are covered
Yep.
on the MCCQE just to make them a little bit more manageable
Yeah.
and a little less intimidating.
Yeah. Less scary for sure.
So today we are going to be doing a deep dive into osteoporosis.
Oh, exciting.
And we are going to be relying on some trusted sources
Yeah.
like Stat Pearls
Yeah?
to make sure that we're giving you guys accurate and up-to-date information.
Most recent guidelines. And a quick reminder before we jump in.
Everything we discussed today is purely for educational purposes and should not be taken as medical advice.
Okay.
Always consult with a qualified healthcare professional for personalized guidance.
This is not a substitute for
Sure.
seeing your doctor.
Yeah, exactly.
Perfect.
Okay.
So Donna, osteoporosis is often called a silent disease.
It is.
Can you explain why it has that kind of ominous reputation?
You're right. It does make it sound a bit mysterious and a bit scary.
Yeah.
It's called silent because, unlike some conditions with clear early warning signs,
Yeah.
osteoporosis often doesn't show any symptoms until a bone fracture occurs.
Oh, wow.
So it's hiding.
And so it's like the ticking time bomb. You might not even know you have it
That's a good analogy.
until something breaks.
Yeah, it is. The underlying issue is that your bones become weak and brittle over time
Right.
due to low bone mineral density
Okay.
and weakened bone architecture.
Okay. So it's not just about
So two things.
the bones getting thinner.
Yeah.
The structure, the architecture inside is getting weaker.
Exactly.
And that's what makes them more susceptible to.
Yeah, it's like a house of cards. It
Uh-huh.
can just crumble,
Right.
even from minor stresses or falls.
Okay. So it's kind of like a building, right? You need to have that solid structure.
Exactly. And just like a building needs constant maintenance,
Yeah.
your bones are constantly being remodeled
Okay.
through a dynamic process.
Right.
It's involving two key players.
Okay. Who are they?
Osteoblasts, they're kind of like the construction crew.
Okay.
They build new bone.
They build it up.
Yeah, and then you've got the osteoclasts,
I
and they're
saw-
more like the demolition crew.
Okay, so they break down.
You've got this constant
It's a-
tug of war between building and breaking down.
Precisely. And that's how bone remodeling works.
Okay.
It's all about this balance between formation and resorption.
So what happens when that balance
That's where things go wrong.
it gets messed up? Yeah, when the breakdown or resorption outpaces that building process,
Right.
the formation,
Yeah.
that's when you start to have problems and bones gradually become weaker
Yeah.
and more prone to those fractures.
Makes sense. So it's not just about losing bone, but the body's ability to keep up with repairs.
Exactly.
Okay, and speaking of building, isn't there something about the strength we build in our younger years impacting our bone health later in life?
Oh, absolutely. The amount of bone mass you accumulate by early adulthood is crucial.
Okay.
It's like setting a solid foundation for a house.
Right.
The stronger that foundation is,
Right.
the better it can withstand wear and tear over time.
So building strong bones during your childhood,
Yeah.
your adolescence, is like making an investment.
It is. It's a long-term investment in your health.
It's paying it forward
It is.
for your future self.
Exactly.
Okay. But let's move on to the different types of osteoporosis.
Okay.
Is it all the same?
That's a great question. Osteoporosis isn't a one-size-fits-all condition.
No.
We can broadly categorize it into two main types.
Yeah.
Primary and secondary osteoporosis.
Okay, let's break those down. What's the difference between the two?
So primary osteoporosis is the most common type,
Okay.
and it's largely related to aging and hormonal changes.
Okay.
Now, within primary osteoporosis, we have two subtypes, type 1 and type 2.
Okay.
Type 1 is linked to the decline in estrogen that women experience after menopause,
Okay.
while type 2 is more age-related
Okay.
and affects both men and women later in life.
Okay, so type 1 is driven by
Yeah, it's hormone-driven.
hormones,
Yeah.
and type 2 is more
And type 2 is more just aging, what happens naturally to all of us.
a consequence of
Yeah, the normal aging process.
aging.
Yeah.
Okay, that makes sense. Now, what about secondary osteoporosis? You mentioned it's triggered by other factors.
Yeah, exactly. Secondary osteoporosis develops as a result of certain medical conditions or medications
Okay.
that can interfere with bone metabolism and increase bone loss.
Okay, can you give us some examples of those conditions or medications
Yeah, absolutely.
that might contribute to secondary osteoporosis?
So, for instance, certain conditions like hyperthyroidism,
Hmm.
where the thyroid gland is overactive,
Uh-huh.
can lead to increased bone loss.
Okay.
Prolonged use of glucocorticoids,
Right.
a type of steroid medication,
Right.
often used for conditions like asthma or rheumatoid arthritis, is
Hmm.
another culprit.
Yeah.
Even conditions like celiac disease and diabetes can impact bone health and contribute to osteoporosis.
That's so helpful, Donna. Understanding these distinctions between primary and secondary osteoporosis
Yeah,
is going to be key for the MCCQE
for sure.
and, more importantly, for identifying patients who might be
At risk.
at higher risk down the line.
Absolutely.
Now, let's move on to those risk factors. Knowing who's vulnerable is so crucial. Wouldn't you agree?
Absolutely. Identifying those risk factors is crucial both for the MCCQE and for your future practice.
Okay.
It's like putting together a puzzle. Yeah?
Where each piece helps us understand who might be more susceptible to developing osteoporosis.
Okay.
We can broadly categorize these risk factors into modifiable and non-modifiable ones.
Okay, so the non-modifiable things we can't change,
Exactly.
like family history, ethnicity, age.
Right. So, for example, white and Asian women are statistically more susceptible to osteoporosis.
Okay.
And having a family history of the condition
Right.
is definitely a red flag.
Okay.
Age is another major factor.
Yeah.
As we get older, the balance of bone remodeling naturally shifts towards more breakdown than buildup.
Makes sense.
And, of course, women are generally at higher risk than men
Yeah.
due to hormonal changes
Yeah.
associated with menopause.
So it's like certain factors predispose
They do.
some individuals to osteoporosis before
Even before lifestyle choices come into play.
lifestyle choices come into play.
Yeah.
Okay, but speaking of lifestyle choices,
Yeah.
those would be the modifiable risk factors.
Exactly.
The things we have some control over. Precisely.
Yeah.
These are the factors where lifestyle interventions can really make a difference.
Okay.
Things like smoking, excessive alcohol consumption,
Yep.
low body weight,
Yeah.
and lack of weight-bearing exercise all increase your risk of osteoporosis.
Yeah. So those are kind of the usual suspects.
Yeah.
The things that we often hear about in relation to just overall health in general.
Yeah, they impact your health in many ways.
But are there any less obvious modifiable risk factors
Oh, for sure.
that future physicians should be aware of?
For example, certain medical conditions
Mhm.
like celiac disease,
Right.
hyperthyroidism, or eating disorders
Yeah.
can increase the risk of osteoporosis.
Right. Those are things you might not immediately think of.
Yeah, they're not always front of mind,
Right. But they're crucial
but they're really important.
to consider. Okay, that's a great point. It really highlights
It does.
how all these different health conditions
Everything's connected.
can kind of influence one another.
Yeah, they all play a role.
So we've talked about what osteoporosis is and who's most vulnerable.
Uh-huh.
Now let's shift gears a little bit
Okay.
and talk about how we actually detect it in patients.
Yeah, great question.
How do we do that?
So the gold standard for diagnosing osteoporosis is a DEXA scan,
Okay.
which stands for dual energy X-ray absorptiometry.
DEXA scan.
Yeah.
It sounds a bit technical.
It does a little bit,
Yeah.
but it's a very safe and painless procedure.
Okay. Can you demystify it for us and explain what it actually measures?
It's actually much simpler than it sounds. A DEXA scan uses low-dose X-rays
Okay.
to measure bone mineral density,
Okay.
usually at the hip and spine.
Right.
It's like taking a snapshot of how much bone mineral is packed into those areas,
Okay.
giving us a clear picture of bone strength.
So it's a way to assess bone density and identify those who might have weakened bones
I guess.
before a fracture occurs.
Before a fracture occurs, ideally.
And I've heard about these mysterious T-scores and Z-scores
Yes, of course.
that come with the DAK scans.
Right.
What are those all about?
So think of them as a way to interpret the results of the DXA scan
Okay.
and compare your bone density to others.
All right.
The T-score compares your bone density to that of a healthy young adult of the same sex.
Okay, so a lower T-score would indicate that your bones are less dense
Exactly.
than the average young adult,
Yeah.
putting you at a higher risk of fracture.
Putting you at higher risk of fracture.
Now, the Z-score
Now the Z-score.
compares your bone density to people of your own age,
Right. Your own age.
sex, and ethnicity.
Exactly.
So it helps us see if your bone density is unusually low.
For someone in your demographic
I'm
group.
just someone in your demographic group.
Which might indicate an underlying issue.
Right, so the Z-score is like a red flag
It's like a red flag.
that something else might be contributing to
Right.
bone loss.
Beyond the normal effects of aging.
Okay,
So it warrants further investigation.
got it. So those scores play a crucial role in making a diagnosis.
They do?
What about blood tests?
Blood tests are important.
Are they part of the evaluation process?
Absolutely. Blood tests are important to rule out any underlying medical conditions that might be contributing to bone loss.
So you're not just looking at the bones themselves, but taking this kind of
You got to look at the whole picture.
holistic approach and
I'll be looking at what?
all
Systems.
systems.
Exactly. So
Right.
we're looking at things like calcium and vitamin D levels,
Okay.
thyroid function,
Right.
even testosterone levels in men,
Uh-huh.
as these can all impact bone health.
Right. So it's all about getting a complete picture
The complete picture.
so you can provide the most appropriate care.
The most appropriate care.
All right. So let's say we've diagnosed a patient with osteoporosis.
Okay.
What comes next? Is it all about calcium supplements?
So while calcium and vitamin D are certainly important,
Okay.
treating osteoporosis effectively requires a multifaceted approach. That includes both lifestyle changes and, in many cases, medications.
Okay, so it's kind of like having
It's a toolbox
a toolbox.
with different tools that we can use depending on the individual's needs and circumstances.
Okay, let's start with the lifestyle modifications.
Okay.
What are some specific recommendations?
So one of the most important things
Yeah.
is incorporating weight-bearing exercises
Okay.
into their routine.
What kind of exercises are we talking about?
Think walking, jogging, dancing, or even strength training.
Oh, okay.
Anything that forces those bones to work against gravity helps build strength and density.
Okay, so get those bones moving and challenge them
Yeah, challenge them safely, of course.
in a healthy way.
Exactly.
Okay, what about diet?
Diet's super important. A balanced diet rich in calcium and vitamin D is crucial.
Okay, so what kind of foods are we talking about?
So dairy products, leafy green vegetables,
Okay.
and fortified foods are all good sources of calcium.
Uh-huh.
And don't forget about safe sun exposure for vitamin D. Yes.
Or supplements if needed.
Or supplements if needed. Of course, we can't forget about those other lifestyle factors.
Right, those big ones.
Like smoking and alcohol.
Huge. Quitting smoking and limiting alcohol intake
Okay.
are essential for bone health
Okay.
and overall well-being.
And for people with osteoporosis, preventing falls.
Oh, yeah.
Yeah.
Falls prevention is
Food
huge
comes a top priority.
because those falls can be so dangerous,
Right.
especially with weakened bone.
Right, because if your bones are weak,
Exactly. You're much more likely to fracture
suddenly
something.
going to break something.
Yeah, okay.
What are some strategies for fall prevention?
It's a combination of things, really.
Okay.
It can involve removing tripping hazards at home,
Okay.
making sure the environment is well lit,
Huh?
using assistive devices like canes or walkers if needed,
Yeah.
and even exercises to improve balance and coordination.
Right. Okay, so multiple
Multifaceted.
approaches. So we've got exercise, diet, and fall prevention as key lifestyle changes. Exactly.
Now let's talk about medications.
Okay.
What are the major drug classes used to treat osteoporosis?
So one of the most commonly prescribed classes is bisphosphonates.
Right.
They work by slowing down the rate of bone resorption,
Okay, so they're kind of
essentially putting the brake.
putting the brakes
Yeah.
on the activity of those osteoclasts.
Exactly, those bone breaking down cells.
The demolition crew.
The demolition crew, exactly.
So they help preserve
Yeah, they help preserve that existing bone.
the existing bone by slowing down that breakdown process.
Exactly.
Can you give us some examples of bisphosphonates?
Sure. Some common examples include alendronate
Okay.
and risvondronate,
Mm-hmm.
which are usually taken orally once a week.
And are there any potential side effects?
Of course, with any medication,
Yeah.
there are always potential side effects to consider.
Right.
With bisphosphonates, some people might experience gastrointestinal issues,
Okay.
like heartburn or nausea.
Right.
In rare cases,
Right.
there can be more serious side effects, like jawbone problems or atypical fractures,
Yeah.
which are fractures that occur in unusual locations.
Oh, wow.
So it's important to be aware of those.
Yeah, keep that in mind. Now, what other medications might be used besides bisphosphonates?
Yeah, absolutely. We also have denosumab,
Okay.
which is a monoclonal antibody
Mm.
that also targets bone resorption,
Okay.
but through a different mechanism.
Okay, and are there any medications that actually stimulate bone formation?
Yes, we do have medications that can stimulate those construction crews.
Okay, bring in
Yeah, bring in the builders.
the builders.
So we have teriparatide,
Okay.
a synthetic form of parathyroid hormone.
Mm-hmm.
It works differently from the others in that it actually stimulates new bone growth,
Wow, so it's not just about slowing down
giving it a boost.
the breakdown, but it's actually boosting
It's about building.
the building process.
Yeah.
Are there any specific populations where osteoporosis needs to be approached differently.
Definitely. For instance, osteoporosis after a spinal cord injury presents unique challenges.
Okay.
Prolonged immobility can lead to incredibly rapid bone loss,
Right.
often resulting in fractures within the first year of injury.
Wow.
It's a stark contrast to the more gradual bone loss we see with aging.
That's a crucial point, especially for future physicians who might be working in fields like rehab or orthopedics.
If you're going to be in those fields.
You need to be aware of this.
Yeah, I need to know this.
That highlights the need for that.
Early intervention is key.
Proactive intervention. Now, before we wrap up this part of our discussion, you also mentioned that osteoporosis in men is often overlooked.
Yeah.
Why do you think that is?
I think there's a misconception that osteoporosis is primarily a woman's disease,
Right.
which is simply not true.
It's easy to see how that misconception could lead to misdiagnoses and delayed treatment in men. So what are some key things to keep in mind when evaluating male patients?
First and foremost, we need to remember that men are just as susceptible to the consequences of osteoporosis,
Right.
including fractures, disability, and even mortality.
So many important things to consider.
You can't let those stereotypes cloud our judgment.
Absolutely. So how can we be more vigilant?
It starts with being mindful of the risk factors.
Okay.
Men with a family history of osteoporosis, those with low testosterone levels, or those taking certain medications like glucocorticoids need to be monitored more closely.
So being proactive, asking those questions. And not just assuming. That bone health is only a concern for a female patient.
Absolutely. And if there's any suspicion, a DXA scan can provide valuable insights and help us make an accurate diagnosis.
Early detection and intervention are key regardless of sex.
Regardless of sex, absolutely.
Now, before we move on to our final thoughts, I just want to emphasize that lifestyle factors play a crucial role in preventing and managing osteoporosis for everyone.
For everyone.
Men and women alike.
Men and women alike.
Excellent points, Donna. We've covered so much ground today, from the basics of bone biology to the nuances of diagnosis and treatment in specific populations.
Yes, it's been a very comprehensive deep dive into a truly fascinating and clinically relevant topic.
Now, before we wrap up completely, I want to remind everyone that this deep dive
is just the beginning.
It's just a starting point.
Yeah. We encourage you to delve deeper into the resources we've mentioned, especially those on stat pearls, to solidify your understanding and prepare for those MCCQE questions.
Perfect. And for those of you who have been diligently taking notes.
Yes, the good students out there.
We will have a summary of key takeaways in the show notes as well.
Always there to help.
Now let's take a moment to gather our final thoughts on this deep dive into osteoporosis.
Sounds good.
All right.
Yeah, it really gets at the heart of preventative medicine. You know, how do we shift from simply reacting to fractures to proactively protecting bone health?
It's a huge question.
Yeah.
And it brings us back to those risk factors we discussed earlier. You know, identifying those who are most vulnerable is a key first step, wouldn't you say?
Absolutely. We need to be thinking about those non-modifiable risks, family history, ethnicity, age, sex, and incorporating those into our patient assessments early on.
So not waiting until someone is in their 60s or 70s to start thinking about bone health.
Exactly.
Especially for women who are at higher risk.
Especially for women.
We should be considering these factors.
Throughout their life.
Throughout a patient's life.
From the beginning.
Yeah. And then we have the modifiable risk factors, which are really powerful because they empower patients to take control.
Where they can take charge.
Of their bone health through lifestyle choices.
It's really lifestyle choices.
Right? Encouraging healthy habits throughout life.
Yeah.
You know, things like regular exercise, a balanced diet, not smoking, and moderate alcohol consumption can make a huge difference in building and maintaining strong bones.
Absolutely. And I think it's important to remember that it's not just about telling patients what to do. It's about working with them to develop sustainable changes that fit their individual needs and preferences.
I like that approach.
Yeah.
It's about making bone health a part of everyday life. Not just a medical checklist, but what about when lifestyle changes alone aren't enough? At what point do we consider medications as part of the treatment plan?
That's where risk assessment tools like the FRAX score can be incredibly helpful.
I've heard of the FRAX score. Can you explain what it is and how it helps guide treatment decisions?
Yeah, so the FRAX score is a fantastic tool that helps us estimate the 10-year probability of a major fracture taking into account both those modifiable and non-modifiable risk factors we've been discussing.
Okay.
It helps us determine the level of risk an individual faces and guide our treatment recommendations accordingly.
So it's not just about looking at a patient's bone density on a DEXA scan, but also considering their overall risk profile.
Right, looking at the whole picture.
To make a more informed decision.
More informed decision, absolutely.
And while the FRAX score is helpful for anyone, it's particularly useful for those with osteopenia.
Yes, particularly useful for osteopenia.
You mentioned osteopenia earlier. Can you remind us what that is and why the FRX score is especially relevant in those cases?
Of course. So osteopenia is that gray area where bone density is lower than normal, but not quite low enough to be classified as osteoporosis.
Okay.
It's like a warning sign that bone health needs attention.
So it's like a stepping stone towards osteoporosis.
That's a good way to think about it, and the FRAX score helps us identify individuals with osteopenia who are at a high enough risk of fracture to warrant medication, even though they haven't yet reached the osteoporosis threshold.
That makes a lot of sense. It's about being proactive and intervening early to prevent those fractures from happening in the first place. Now, going back to medications for a moment, we talked about bisphosphonates, denosumab, and teriparatide as options. Are those the only medications available for treating osteoporosis?
Those are some of the most common and well-established treatments, but there are a few other medications out there. The treatment landscape is constantly evolving, and new options are emerging all the time. For instance, romosozumab is a newer medication specifically approved for use in postmenopausal women with osteoporosis.
It sounds like staying up to date on the latest treatment options is crucial.
Oh, it's crucial.
For physicians, especially in a field as dynamic as this. Now, you mentioned earlier that osteoporosis after spinal cord injuries requires a different approach. What makes it so unique and challenging?
The rate of bone loss after a spinal cord injury is incredibly rapid. We're talking about potentially losing up to 50% of bone mass in the paralyzed limbs within the first year alone.
Wow.
It's a stark contrast to the more gradual bone loss we see with aging.
That's alarming. It really highlights the critical importance of early intervention in those cases. What can be done to protect bone health after a spinal cord injury?
We need to be very proactive. This includes starting calcium and vitamin D supplementation right away, encouraging any possible weight-bearing activity, even if it's limited, and considering medications like bisphosphonates or teriparatide much earlier in the course of treatment.
It sounds like a race against time.
It is.
To preserve as much bone mass as possible and prevent those devastating fractures. Now, before we wrap up our discussion, you also mentioned that osteoporosis in men is often overlooked. Why do you think that is?
I think there's a misconception that osteoporosis is primarily a woman's disease, which is simply not true. While women are at higher risk, especially after menopause, men are certainly not immune.
It's easy to see how that misconception could lead to misdiagnoses and delayed treatment in men. What are some key things to keep in mind when evaluating male patients for osteoporosis?
First and foremost, we need to remember that men are just as susceptible to the consequences of osteoporosis, including fractures, disability, and even mortality. We can't let those stereotypes cloud our judgment.
Absolutely. So how can we be more vigilant and ensure we're not overlooking osteoporosis in men?
It starts with being mindful of the risk factors men with a family history of osteoporosis, those with low testosterone levels, or those taking certain medications like glucocorticoids need to be monitored more closely.
So being proactive and asking those questions, not assuming that bone health is only a concern for our female patients.
Precisely. And if there's any suspicion, a DEXA scan can provide valuable insights and help us make an accurate diagnosis.
Early detection and intervention are key, regardless of sex. Now, before we move on to our final thoughts, just want to emphasize that lifestyle factors play a crucial role in preventing and managing osteoporosis for everyone, men and women alike.
I couldn't agree more. Encouraging regular exercise, a balanced diet, and avoiding smoking and excessive alcohol can make a significant difference in building and maintaining strong bones throughout life.
Excellent points, Donna. We've covered so much ground today, from the basics of bone biology to the nuances of diagnosis and treatment in specific populations.
It's been a very comprehensive deep dive into a truly fascinating and clinically relevant topic.
Now, before we wrap up completely, I want to remind everyone that this deep dive is just a starting point.
Absolutely. We encourage you to delve deeper into the resources we've mentioned, especially those on Stat Pearls, to solidify your understanding and prepare for those MCCQE questions.
Great point, Donna. And for those of you who've been diligently taking notes, we'll have a summary of key takeaways in the show notes as well.
Always there to help.
Now let's take a moment to gather our final thoughts on this deep dive into osteoporosis. So Donna, what's the one thing you really want our listeners to take away from our deep dive into osteoporosis today?
You know what's really interesting about osteoporosis, despite its reputation as a silent disease?
Right.
It actually offers us a real opportunity for proactive intervention, by shifting our focus from reaction to prevention. We can make a huge impact on public health, reducing suffering and easing the burden on our healthcare system.
I completely agree. We've talked about early detection and intervention being key, but how do we actually put that into practice? What are some concrete steps we can take as future physicians?
It all starts with education.
Okay.
Both for healthcare providers and for the public. We need to move beyond thinking of osteoporosis as just an old age issue.
Yeah.
It's really crucial to emphasize building strong bones throughout life, starting from childhood.
I love that idea. So encouraging kids and teenagers to adopt healthy habits early on.
Yes.
Like getting enough calcium and vitamin D, engaging in weight-bearing activities.
Exactly.
Setting them up for success from a young age.
Set them up for success early.
And for adults, it's about promoting those same healthy habits.
Absolutely.
But also increasing awareness of the risk factors
Yeah.
and encouraging appropriate screening when necessary.
For sure.
Right. And as we discussed earlier, not making assumptions about who's at risk. We need to be mindful of the risks for both men and women.
Absolutely. And this brings up an interesting question. How can we actually improve screening rates and ensure that those who need treatment are actually getting it?
Right.
There's a gap there that we need to address.
That's a great point. Maybe we need to start incorporating osteoporosis risk assessment into routine checkups for all adults.
I love that idea.
Make it part of the standard protocol.
Yeah, just make it standard.
Yeah.
And perhaps we can leverage technology to make screening more accessible and convenient.
Right.
Think about things like telemedicine, especially for those in rural areas who might have limited access to specialists.
Right. Using technology to break down those barriers to care.
Exactly.
And when it comes to treatment itself, we need to remember it's not just about prescribing medication.
Oh, absolutely. It's about taking that holistic approach, considering each patient's individual needs and preferences, and providing support to help them make those sustainable lifestyle changes that will benefit them in the long run.
It's about empowering patients to take an active role in their own health. And let's not forget about the incredible advancements being made in osteoporosis research.
Oh, it's so exciting.
New treatments and preventative strategies are constantly emerging.
All the time. It's really a dynamic field.
Well, this has been a fantastic deep dive. Donna, we've covered a remarkable amount of information, and I feel like we barely scratched the surface.
It's true. Osteoporosis is a multifaceted topic with far-reaching implications.
But armed with the knowledge we've gained today, our listeners are well on their way to becoming informed and compassionate physicians prepared to make a real difference in the lives of their patients.
I completely agree. And to our listeners, remember, this deep dive is just the beginning of your journey. Keep learning, keep asking questions, and keep pushing the boundaries of knowledge.
Excellent advice, Donna. And remember, you can always revisit the sources we've mentioned, especially stat pearls, to deepen your understanding and prepare for those MCCQE questions. We'll have links to everything in the show notes.
We'll have all the resources there for you.
Thank you for joining us on the deep dive today. We hope you found this exploration of osteoporosis insightful and empowering. Until next time, keep diving deep and keep those brains engaged.